Alright, so today we are going to talk about a very important element of the respiratory tract that is also known as the voice box, that's larynx. Larynx is the anteriorly lying tube, so remember we have the posterior incomplete tube, that is pharynx, and in front of the pharynx is lying the larynx, and both of these tubes are in the midline of the column of neck. Alright, so the larynx is a collection of hyaline cartilages and membranes, majority of the hyaline cartilages and membranes, and it's been suspended within the column of neck with the help of a bone that is known as the hyoid bone. Alright, here is the model of the hyoid bone. This bone is the only bone in the body which is also known as a floating bone, because it's been suspended within the column of neck with the help of some ligaments and membranes. There is no bone-to-bone joint formation when it comes to the hyoid bone. Okay, we are unable to palpate our hyoid bone within our neck because it's been covered by most of the strap muscles of the neck, and also the structures which are the glandular structures which are lying in the column of neck. So it's difficult to palpate the hyoid bone, but it is present in the upper cervical region, or at the level of the upper cervical vertebrae. Okay, and of course it's lying below the level of mandible. All right, so larynx is a very complicated part of the respiratory tract. It doesn't involve any bone. It's formed by cartilages and membranes, but the arrangement of those cartilages and membranes is in such a way that creates a lot of confusion. So what I have done before moving on to a proper model of the larynx, I have made some clay models of the laryngeal cartilages. Okay, so we have altogether 9 cartilages which are making the framework of larynx. Here on this piece of cardboard I have arranged them from top to bottom, like from above down. Okay, so I hope that you would be able to see the arrangement. Let me tilt this thing a little bit and let's talk about it. On top you can see this U-shaped bone, that is the hyoid bone, it's white color. Below the hyoid bone is a purple leaf-shaped, or rather spoon-shaped structure, which is the unpaired laryngeal cartilage, that is the epiglottis. It's made out of elastic cartilage. Then there is an orange colored shield-shaped cartilage that is also an unpaired cartilage, that's the thyroid cartilage. Below the thyroid cartilage we have these blue colored wedge-shaped cartilages. There is a pair, and these are known as cuneiform cartilages because they are of the shape of a wedge. Then below the cuneiforms we have 2 brown colored cartilages sitting on top of the 2 yellow colored cartilages. These brown colored cartilages are the corniculate cartilages because of their shape. They look like small corns. Then they're sitting on top of the yellow cartilages, which are, again, it's a pair, and they are known as arachnoid cartilages. And the cartilage which I'm holding is the last one. It's again an unpaired cartilage that's known as the cricoid cartilage. So if I go through again, below the hyoid we have 3 unpaired cartilages of larynx in the midline: the epiglottis, the thyroid cartilage, and the cricoid cartilage. The paired ones are basically, they are hidden behind the shield of the thyroid cartilage. You won't be able to see these cartilages, the paired cartilages, without flipping off the larynx. They are not visible from anterior aspect. So we have a pair, those are the cuneiform cartilages, blue colored wedges. Then we have the corniculate cartilages, which are brown colored corn-shaped cartilages, very small. Then we have the arachnoid cartilages, which are boot-shaped or pyramid-shaped cartilages. They are also paired. And then, yeah, the last one was the unpaired cricoid cartilage. Okay, so altogether, our larynx is made up of 3 unpaired cartilages and 3 paired cartilages. Now I will start on with the hyoid bone, and then I will move on to the individual features of each cartilage. The hyoid bone is a U-shaped bone. As you can see, it's pretty much like the body of the mandible, and it's lying below the mandible, like it's lying between below the mandible and the floor of the mouth. So many muscles of the floor of the mouth are also coming and giving attachment to this bone, like the mylohyoid muscle. Okay, one of the examples. So the hyoid bone has a body and 2 lesser horns or lesser cornua, then 2 greater horns. Okay, these greater horns will make a joint with the horn of the superior horn of the thyroid cartilage, and we'll see all that in a few minutes. Okay, now we put this hyoid bone aside, and now we will start on with the laryngeal cartilages. So here it's a leaf-shaped, rather a spoon-shaped cartilage, and it's made up of elastic tissue. It's elastic cartilage, and it never gets calcified throughout our lives. And it's known as the epiglottis. Why? Because it's lying on top of the glottis, which is the name for the laryngeal inlet, okay, through which the air goes in and comes out of the larynx. Okay, then we have excuse me, another unpaired cartilage. That is, it looks like a shield. Okay, so this is the thyroid cartilage. So let me describe the thyroid cartilage. It has an inferior border with a shallow notch in the midline. So this is known as the inferior thyroid notch. Then we have a superior border, and that superior border also has a midline notch, which is very deep. It's U-shaped. So this is the superior thyroid notch. And these are the 2 laminae of the thyroid cartilage. During the intrauterine life, the thyroid cartilage develops in the form of 2 flat plates, the laminae, and then they fuse in the midline. Okay, so you must have noticed that in young males we can observe this pointy Adam's apple in their neck. Whenever they are talking, this Adam's apple is bobbing up and down. That is the prominent spot of the lamina, where the 2 laminae fuse each other. Okay. On each lamina of the thyroid cartilage, we can see these brown colored lines. These are the oblique. They're running obliquely. So they are the oblique lines of the thyroid lamina. They provide attachment to some of the thyroid muscles, the extrinsic laryngeal muscles. Okay. Then we have the posterior borders of the thyroid cartilage, and I told you that the larynx is deficient in posterior wall. Okay, so the posterior borders are free. The posterior border, it extends down to the level of lamina, and it extends up to the level of lamina. So it creates on either side 2 inferior horns, or the inferior cornua of the thyroid cartilage, and 2 superior horns or superior cornua of the thyroid cartilage. These are the superior cornua of thyroid cartilages, which will be making a joint with the greater horn of the hyoid bone with the help of thyrohyoid ligament, okay, on each side. And the inferior horns or inferior cornua of thyroid cartilage will be articulating or making a joint with on either side of the cricoid cartilage, the cricothyroid joints. okay, with the cricothyroid ligaments, lateral cricothyroid ligaments. We will be talking about the ligaments and membranes of larynx in few minutes, okay? All right. So this is the external appearance of the thyroid cartilage, which is an unpaired cartilage. It's hyaline type, unlike the epiglottis, which is elastic type. Then we have another unpaired cartilage. No, before that, let me go to these two wedges. These are cuneiform cartilages. They are present within the aryepiglottic folds, okay? They make the core of the aryepiglottic folds, which is the fold of the membrane of larynx, the mucosal membrane of larynx, and we'll be talking about it in a few minutes. What is happening is each cuneiform cartilage is making a joint with the corniculate cartilage of that side, okay? The corniculate cartilage is like it's like a corn, and it's making a joint with the arachnoid cartilage. Okay, so we have a pair of arachnoids, we have a pair of corniculate, we have a pair of cuneiform. So they are present on either side of the midline. So are the aryepiglottic folds. Okay, now look at the arachnoid cartilages. Each arachnoid cartilage is roughly looking like a pyramid with 3 processes and a base. So what is happening, the base is sitting on top of this cartilage, which is the last cartilage of the larynx, an unpaired cartilage, the cricoid cartilage. So the base of the arachnoid cartilage is making a joint with the cricoid cartilage, cricoarachnoid joint, which is a synovial type of joint, and it allows the movement of the arachnoid cartilage. So the arachnoid cartilages can rotate and they can also glide at this joint, okay? So I come back to the anatomy or the structure of the arachnoid cartilage. So we have a vocal process, which is the anteriorly projecting process. It's facing the laryngeal cavity, okay? Then we have a posterolaterally located process that is stouter than the anterior process, and it's known as the muscular process. The muscular process of the arachnoid cartilage gives attachment to, this is the muscular process. So the anterior one is the vocal, and then the posterolateral one is the muscular. The muscular process gives attachment to the intrinsic muscles of larynx, and we'll be talking about those intrinsic muscles when we'll be discussing the musculature of larynx, okay? Then we have the tip or the apex of the arachnoid cartilage, which has been occupied by the corniculate cartilage. It's making a joint with the corniculate cartilage. So this is our arachnoid cartilage. So we have a pair, and they are sitting like this, facing the cavity or the inside of the larynx, okay, and sitting on top of the lamina of the cricoid cartilage, okay. I will remove the arachnoid cartilages, and then you'll be able to see the last cartilage of the larynx, which is, I call it the foundation. It makes the foundation of the larynx, the cricoid cartilage. Okay, it's an unpaired hyaline type of cartilage, and it limits the, or it just it marks the end of the larynx. Okay, it's the only laryngeal cartilage which is a complete ring, as you can see. Okay, it has an anterior arch and a posterior lamina. Okay, the lamina has the sloping shoulders on which were residing or resting the bases of the arachnoid cartilages. Okay, this is how the cartilages of larynx have been arranged, the paired and unpaired ones. Now in between these cartilages, as you have seen that each cartilage is having many gaps, and they're not joined with each other with the help of, like, you know, straightforward joints, right? So the gaps must be covered by membranes. Those membranes, most of them are fibroelastic membranes. So they help the larynx to expand, you know, during the process of swallowing or deglutition, as well as the process of phonation. So these the fibroelastic membranes play a very important role. First of all, they are completing the framework of the larynx, which is nothing but the collection of different shaped cartilages. And yeah, so let me show you a proper model of larynx, and then we will talk about the membranes and the internal structure or the inside of the larynx. Here is a model of larynx. As you can see, this is our hyoid bone, U-shaped, lying below the mandible, and it is holding, by the way, in this model there is no membrane visible, but we have to imagine that there is a thick fibroelastic membrane present between the inferior border of the hyoid bone and the superior border of the thyroid lamina, okay? The thyrohyoid membrane. With the help of this thyrohyoid membrane, the entire apparatus of the larynx and trachea has been suspended in the column of neck, okay? So these are the two thyroid cartilages, the thyroid laminae and the superior thyroid notch, and this is our epiglottis, which is a mobile cartilage, okay? It's elastic in nature, okay? It's always moving because it's playing a very important role, because whenever we are swallowing something, the epiglottis has to get depressed, right? And it is going to cover the laryngeal inlet. This is the arch of the cricoid cartilage, which is visible from front. The lamina is visible from behind, okay? So the gap between the inferior border of the thyroid cartilage and the superior border of the cricoid cartilage has been filled up by the cricothyroid membrane, okay? Then we have below the cricoid cartilage, we have the tracheal rings, okay? The inferior border of the cricoid cartilage, it just terminates at the vertebral level, the vertebral level of the end of cricoid cartilage, or the end of larynx, is 6th cervical vertebra, if you remember, right? So it's at the level of 6th cervical vertebra, the larynx is finished, and the tracheal apparatus will start, okay? If I flip this model, you will be able to see those small paired cartilages. Not all of them, but some of them are still visible in this model. So, by the way, this is the broad, flat cricoid lamina, the posterior lamina of the cricoid cartilage. And on top of the lamina were residing the two boot-shaped or the pyramidal shaped cartilages, the arachnoid cartilages. On top of the tip of the arachnoid cartilages were residing, or they were making a joint with the arachnoid, are the corniculate cartilages, okay? The cuneiform cartilages are not visible over here because there is no area epiglottic fold which is present, okay, in this model. Now let's talk about the membranes and ligaments of the larynx. There are certain ligaments and membranes which are visible from outside. Like if you view the larynx, once you open up the skin of the neck, and because larynx is the anteriormost tube which is visible, and you've removed the skin, subcutaneous tissue and the platysma muscle, you will be able to see this apparatus, okay? So the membranes which are visible anteriorly would be the most obvious one would be the thyrohyoid membrane, right? In the midline, this membrane will show a thickening, that would be the median thyrohyoid ligament. On the sides, extending from the greater cornu or horn of the superior, not greater, the superior horn of the thyroid cartilage till the level of the greater horn of the hyoid bone, would be extending a thick band, like a cord-like band, which is known as the lateral thyrohyoid ligament. So we have a pair of lateral thyrohyoid ligaments, which are the thickening of the thyrohyoid membrane. And then there is, in the midline, there is a median thyrohyoid ligament, which is again thickening of this thyrohyoid membrane. Okay? Then we have to fill out the gap between the anterior arch of the cricoid cartilage and the inferior border of the thyroid cartilage. There is a cricothyroid membrane. Okay, the cricothyroid membrane is also, it gets thickened in the midline, and it forms a structure which is it's fibroelastic in nature, and it's known as conus elasticus. Okay, so we will talk about the conus elasticus when we will be discussing the inside, the inner membranes of the larynx. But at this moment, what we can see from outside, from an anterior aspect, is the cricothyroid membrane, and in the midline, there is a small extension from the anteriormost portion of the arch of cricoid cartilage, and up to it extends up to the level of the inferior notch of the thyroid cartilage. This band is very tough, and it's known as the median cricothyroid ligament. Okay, and then laterally, the inferior horns of the thyroid cartilage are making, with the help of a ligament, they are making a joint with the arch of the cricoid cartilage. So the cricothyroid joint. So we have two of them on either side. Okay, these are the membranes and the ligaments which are visible from outside. Now, what we have done is we have flipped the larynx. We have removed the wall, the posterior wall, which has been formed by the laryngopharynx or the hypopharynx, and you are able to look inside, peep inside the laryngeal apparatus. Okay, we can see these cartilages and everything, and keep in mind that the membranes which are present inside the larynx are different because they are covered by the laryngeal mucosa. Okay, the laryngeal mucosa is a glistening lining, and we'll be talking about it separately. Okay, so look at this structure. It's the epiglottis. The oral surface, or the top surface of the epiglottis, the superior surface, is facing the base of the tongue, and the inferior surface is facing the laryngeal inlet. Okay, so this is the laryngeal surface of the epiglottis. Alright, so first we will talk about a very important membrane that is known as the quadrangular membrane, and this membrane its shape is somewhat like this, and it's present on either side because we have the two lateral borders of the epiglottis, right? Inferolateral borders, a right and a left. Okay, so we have two right and left quadrangular membranes. I will use just one quadrangular membrane to give you the idea. Okay, so look at this. This is supposed to be the anterior border of the quadrangular membrane. It has four borders. That's why it's known as quadrangular, because this is the anterior surface of the larynx, and this is the posterior surface, and we have removed the pharynx. So the anterior border of the quadrangular membrane is attached to the inferolateral border of the epiglottis. Okay, this is the anterior border, this one. Okay, while the posterior border is way smaller, and it is occupying the space between the apex of the arachnoid, or where the corniculate cartilage is sitting, and the vocal process of the arachnoid. I hope that you're able to see the vocal process. Let me remove the vocal process of the arachnoid cartilage. This space between the apex of the arachnoid and the vocal process of the arachnoid is being filled up by the posterior border of the quadrangular membrane. Okay, it's like this. Oh my God. Yeah. Okay, somewhat like this. So we can say that the anterior border of the quadrangular membrane is way longer than the posterior border. And then we have this superior border. The superior border is like a sloping ridge. And it's also, because it is running between the arachnoid cartilage and the epiglottis, so we call it the aryepiglottic fold. So the superior border of the quadrangular membrane is nothing but the aryepiglottic fold, which contains the cuneiform cartilage, if you remember. So here are the corniculate, and they were articulating with the cuneiform cartilage. And I told you that the cuneiform makes the core of the aryepiglottic fold. And then also in the fold would be the aryepiglottic muscle, which is the muscle, or it's the constrictor of larynx. So the superior border of the quadrangular membrane is making the aryepiglottic fold. The anterior border is fixed with the inferolateral border of the epiglottis. The posterior border is fixed with the gap, or the space between the apex of the arachnoid cartilage and the vocal process of the arachnoid cartilage. Now we are left with this free border, which is the inferior border. Opposite the superior border, we have the inferior border. This inferior border is free, and it is the border which makes the vestibular fold. Okay, the vestibular fold is sitting on top of the vocal folds, right? Okay, so this is how the quadrangular membrane on each side is covering the larynx, like this. So we have two quadrangular membranes, all right? And we have discussed the borders, and I'll show you in a drawing as well, so you'll be able to have a better concept. Yeah, but you know, let me give you the idea that this is our clay model, and I have made two folds present inside the laryngeal cavity, or they are present at the inner side of the thyroid cartilage. Remember, I told you that the Adam's apple, the prominent spot of the thyroid cartilage, is representing the attachment site of the vocal cords, or the vocal ligaments. The white colored cords are representing the vocal ligaments, and the green colored structures, or the bands, are representing the vestibular ligaments. Okay, and they are also known as the false vocal cords. Okay, these are the true vocal cords. This is nothing. The vestibular ligament is nothing but the free margin of the quadrangular membrane, because remember, this was the epiglottis, and the membrane was running between the inferolateral borders of the epiglottis, yeah, and here were the arachnoid cartilages. So here is our arachnoid cartilage sitting at the lamina of the cricoid cartilage, and it has a vocal process and has an apex. So the apex and the vocal process has been, the gap between these two processes has been filled up by the posterior border of the quadrangular membrane, and here we have the vocal cord. Yeah. So this whole thing has been filled up by the quadrangular membrane, and the free margin of the membrane is known as the vestibular fold or vestibular ligament. The space between, when we are discussing the vocal folds and the vestibular fold, let me explain or just give you the idea of a term we use all the time, the ventricles of the larynx. This space between the vestibular fold and the vocal folds is known as the ventricle of the larynx. So we have a pair of ventricles, one on each side. The space or the gap between the vestibular fold above and the vocal fold below is known as the ventricles. These are the blind pouches present on either side of the vocal or present on either side of the larynx, okay? These are the laryngeal ventricles. Alright, now we'll come to the second membrane that is known as the conus elasticus. To understand the conus elasticus, first of all, again, it's a fibroelastic membrane, has a lot of elasticity in it, and it's an internal membrane. So both the quadrangular and conus elasticus are fibroelastic membranes, okay? I have another simplified model made out of tissue paper. Here is our cricoid cartilage, and you know that the thyroid, okay, let me remove it. The thyroid cartilage, the inferior horns of the thyroid cartilage, they are articulating with the cricoid cartilage, making the thyroid joints, okay? And the gap, this triangular gap, I hope that you're able to see, this triangular gap has been filled up by the thyroid membrane, okay? So the cricothyroid membrane. And I told you that in the midline, there is something. Oh, let me flip. Yeah. In the midline, running between the inferior notch of the thyroid cartilage and the anterior-most part of the arch of cricoid cartilage is running a ligament, the cricothyroid ligament. The cricothyroid ligament is a very tough ligament. It's a part of the cricothyroid membrane. And now you have to imagine a little bit that this cricothyroid ligament is moving in, it's going in. And this is the midline ligament, okay? So we'll go like this, it's going in. Okay? So only a little part of this ligament is visible. It's actually making the conus, it's a part of the component of the conus elasticus, the midline cricothyroid ligament, okay? You are unable to see what is happening inside and why it is known as conus elasticus, because of its shape. So the top part of the median cricothyroid ligament has been expanding like a cone. And now I will move and I will flip the model to show you what is happening inside, behind the thyroid lamina, okay? Yeah. Let me remove the cricoid cartilage also. Yeah. We know, you have this imagination that the arch is there, the cricoid arch is there. Now look at this. This is a fibroelastic membrane, and it is having the inferior part of this membrane is nothing but the median cricothyroid ligament, and then it just expands in a conical fashion, and then at the top it's giving rise to the free borders of this membrane. They are forming nothing but our vocal cords, okay? The vocal ligaments or the vocal cords, which are elastic, okay? So these, the white colored, they were the vocal cords, just below the vestibular cords. So they are nothing but the free borders of the conus elasticus. So we have the two membranes. The free border of the quadrangular membrane, which is coming from top, is making the vestibular fold. The free border of conus elasticus, another membrane which is coming from below, from the cricoid cartilage, it's making the vocal ligaments or the vocal cords. Because this is it's a highly elastic membrane, so are vocal cords. They are elastic. What is the difference between, why do we call them true vocal cords and why do we call them false? Because the vestibular ligaments or the vestibular folds, they are just the mucosal folds having the free margin of the quadrangular membrane. And those free margins are instretchable, okay? They will not participate during the process of phonation. While the free margin of conus elasticus, it's making the vocal ligaments or the vocal cords, it's highly elastic in nature, okay? So the vocal folds, which are the enfolding of the laryngeal mucosa, will be having these vocal ligaments or the vocal cords. They will always be acting when we will try to talk. Okay, they will vibrate, they will expand, they will, get tense, they will get relaxed, they will get shortened, and they will get lengthened. They get lengthened in size, and their movement will be there. This is not the case with the vestibular folds, okay, or the vestibular ligaments. That's why they're known as false vocal cords. What is their purpose? They are providing an extra protection to the original cords, the true vocal cords, okay? So they are creating a shelf, and what you will be able to see beneath the vestibular folds will be the true vocal cords, will be vibrating. If you will ask your patient to say E or ah, so there would be vibration of these cords, not the vestibular cords or the vestibular folds, okay? I hope that you have understood the concept of the two membranes, the quadrangular membrane and the conus elasticus. These are the two internal membranes which are playing a very important role. They are giving rise to the important structures present within the laryngeal cavity, and they are different from the external laryngeal membranes, which are just filling out the gaps between the hyoid bone and the thyroid cartilage, and the gap between the cricoid cartilage and the thyroid cartilage, and those are the fibrous bands and filling out the gaps, okay? Now I'll take you to a board drawing and will show you further how you can define the conus elasticus and the quadrangular membrane, and then we'll move on to the musculature of the larynx, especially the intrinsic musculature, which is responsible for the movement of the larynx as well as it's involved in the process of phonation. Okay, now look at this drawing. So you picture this is the larynx, and you have sectioned it, and you're able to see the inside after removing the side wall. Okay, so now look at this. This structure is the quadrangular membrane. Here is the epiglottis and the inferior surface of the epiglottis, which is the laryngeal surface. It gives attachment to the anterior border of the quadrangular membrane. And then we have the posterior border, which is attached to, this is the arachnoid cartilage and the apex of the arachnoid cartilage and the vocal process of the arachnoid cartilage. This gap has been filled up by this border of the quadrangular membrane, which is known as the posterior border. So we have the anterior border and the posterior border. Then we have the superior border, which is making the aryepiglottic fold, okay, which is like a slope, And that is the border which is visible when you try to look inside the laryngeal inlet. So you ask the patient to open up the mouth and you're examining his larynx and he's saying ah, so you will be able to see these airy epiglottic folds on either side, right? Like this. Then the superior border, against the superior border is the inferior border, which is free. It's the free border of the quadrangular membrane. It's making the vestibular fold. Okay? Now, this structure is the conus elasticus. Right? This is the conus elasticus. Okay? So here is the arch, the anterior arch of the cricoid cartilage, and we have removed the thyroid cartilage lamina, so you're able to see that how the median ligament is going in and expanding in a conical fashion, and its free upper or superior border is giving rise to the vocal cord, right, or the vocal ligament. So if you imagine that this is a pair of the vocal cords or vocal ligaments, one on this side, the other would be on the other side. So the conus elasticus is expanding, right, and giving rise to two free margins, two free superior margins, the vocal cords. And on top of that would be the vestibular ligament, which is the free margin of the quadrangular membrane. Okay? Now we'll move on to the other drawing. Alright, this drawing is actually representing a view in which you can, you are actually observing the larynx from the top through the oral cavity. Okay, so this is the epiglottis, okay, and then you are looking inside the vestibule of larynx, okay. So these will be the airy epiglottic folds. So here are the airy epiglottic folds, and they are having the corniculate and the cuneiform cartilages, right? Remember the superior border of the quadrangular membrane running between the arachnoid cartilages and the inferior surface of the epiglottis. So what I want to show you, so these are the true vocal cords, and these are the ventricles, the gap between the false vocal cord and the true vocal cord, okay? This region, which is visible when you ask your patient to breathe, this region, the vocal cords will be expanding, or they will be abducting, and will be showing you the inside of the larynx. Okay, the space between the true vocal cords is known as the rima, because it looks like a rim, right? Rima glottitis. Okay, rima glottitis. Rima glottitis. Yeah. Rima glottitis is the space between the two true vocal cords. And these are the airy epiglottic folds. Alright. Let me talk about a few other things, a few other terminologies we use when we talk about the larynx, or the anatomy of the larynx. So, the region which is present above the vocal cords, above the true vocal cords, this whole region is known as the supraglottic region, because the space between the two true vocal cords is known as glottis or rima glottitis. So anything which is above the level of this space is known as the supraglottic region. Okay, this is also known as the vestibule of larynx. Okay, because the thing which is under the cover of the epiglottis is the vestibule of larynx. Anything Any region, expanded region, which is, it acts like a receptacle, is known as vestibule. So we have a vestibule of nose. We also have a vestibule of larynx that receives the air. Okay, so the region of the larynx above the vocal folds is known as the vestibule. It terminates at the level of the vestibular folds. Okay, rather it includes the ventricles, which is the space between the vestibular fold and the vocal folds. So the vestibule terminates at the level of the true vocal folds, or the true vocal cords, okay, which are visible. I believe you would be able to see these are the vocal cords. Okay, yeah. Then the region below, which is visible inside, like which when you ask the patient to breathe in deeply, his vocal cords will be abducted to the most, and you will be able to see the inside of the larynx. That region is known as, where I'm entering my pencil, this region is known as the infraglottic region. Okay, so the supraglottic region, everything above the true vocal cords. The infraglottic region is everything below the true vocal cords. Okay, so then what else do we have? We just have discussed the folds, the vestibular folds and the vocal folds. Then we have something which is also known as the vallicula. Okay, the valliculae, we have two valliculae.